So we've got Niki Jones. Niki is one of our flippin' pain friends. She's a person living with persistent pain, and she's going to tell us about her really remarkable and inspirational pain journey. Over to you, Niki.
Hi, everybody. Yeah, my name's Niki. I'm 48. I've lived with pain since I was 16 and fell off a horse. But my big pain journey started on Christmas Eve 2002, when basically someone stuck a cattle prod to the side of my head and never stopped for 16 years. I was pretty quickly diagnosed with trigeminal neuralgia, which is a facial pain condition. And I later developed neurogenic headaches, which were extraordinarily painful and completely incapacitating. But 2 years ago, all that changed. It's hard to fit 16 years into 7 minutes. So to summarize, during my pain journey, I tried all the drugs and I ended up on a very high dose of fentanyl. I tried all the surgeries. I had 3 microvascular decompressions. None worked for very long. And I actually ended up with a motor cortex stimulator on my brain. That sort of gave me about 30% pain reduction, never anymore. And I had several pain revisions, wire revisions, and it actually caused occipital neuralgia. I did do a pain management course in 2005, which was very good, but it was very focused on management, and I was still focused on treatment, and the pain science was very old. It was still pain gate theory, which didn't make much sense to me. It's hard to give an account of the effect of the pain on my life, but I'd been a successful professional living in London. With the pain, I ended up having to move back to Wales with my family. The fear, the depression, the fatigue, the constant fight. It was really hard. Trigeminal neuralgia has triggers, so I couldn't have any wind or rain on my face, so I had to cover my face all the time. I couldn't wash my hair, brush my hair, have my face kissed or touched. I couldn't clean my teeth often or talk. Bright lights, loud noises, all of this just sort of devastated my life. It destroys your dreams, your plans, and you get more and more sensitive and disabled. So 2 years ago, I was hard pushed to even walk a kilometre without enormous pain and fatigue. I fell into a hole. I was incurious. I was drugged up. I was depressed. I was plodding and coping in a rut. I tried to live a good life, but it was still smaller, darker, and constrained. Medically, I was shelved after the stim. There was just no more treatment that they could give me. I saw a rehab consultant occasionally. My neurosurgeon just sort of tinkered with the stim and didn't do any more changes and just changed the battery when needed. The GP just churned out the fentanyl. There was never any update on the pain management course. Patients don't get CPD, it appears. I never saw a physio, especially for the facial pain. Then towards 2018, some things fell into place for me. I got an escape medication for the neurogenic headaches, which meant that I could actually go out a bit more. I felt a bit more free. I was able to reduce the fentanyl by 25%, which gave me a bit of life and a bit of oomph back. I still believed it was helping me. As a spoiler, it wasn't. I started ballet lessons. I started using my body for me, just to enjoy my body. And I woke up enough to feel the loss of control and be really frustrated by this. I needed to take some control. I just didn't know how. Then I saw an ad for a pain management program in app form. While I was researching the app, I realized how much pain science had moved on. And I found Lorimer Moseley's videos on YouTube. And I watched all of them again and again. And they made such a massive impact on me. I dove deep. I watched David Butler, Dr. Schubiner, Darnell, Clark, Strax, and a myriad more. I was pretty Catholic in my research and viewing. I did see the source papers, but I was better with video and podcasts. And all of this allowed me to reconceptualize the pain. I could see it as essentially a brain misfunction. The pain was very real, but it was a corrupted pathway, not damage, not harm, not danger. And this dramatically lowered the fear levels for me, and then thus the focus. So understanding the new pain neuroscience gave me the why. It gave me a feeling that I could control this. The app gave me the how. It involved serious brain retraining, a lot of psychological work around emotions, around the past, about how it causes unhelpful patterns in the now, journaling, more education, lots of meditation and mindfulness, finding joy again, curiosity, movement, connection, and many other lifestyle changes. And within a few months, my TN pain levels had plummeted. The neurogenic headaches reduced in frequency, in intensity, and the fatigue improved slowly. So 2 years on, I'd say I'm 99% pain-free. I do get the occasional flares, but they're actually very easy to ignore. But you can't underestimate the hard work this has taken. The app program took several months and took courage, commitment, honesty, determination, and a lot of perseverance. And all of this was completely unsupported by anybody medical. And then after that came the graded exposure and the reconditioning of my body, which after 16 years was struggling. I did ballet, walking, yoga, lots of land maintenance on the small holding here, and more lately, cycling. I went from 5 kilometers at the start of lockdown to 30 kilometers now, and it's awesome. Trigeminal neuralgia has many triggers of the pain, as I mentioned. So I actually managed to use my understanding of horse and animal behavior training to decondition all of those triggers. I used graded exposure with positive reinforcement and lots of safety in me self-talk. So due to that process, I can now cycle in the wind with nothing on my face, on top of mountains where the wind is really strong. I talk a lot and a lot. I shower a lot. Previously, I hadn't had a shower for 16 years. I did wash, I have to say. When there's not COVID, I do go to gigs now. I socialise, I swim. I've even been surfing. I have a fringe, which was once impossible. And I clean my teeth with an electric toothbrush. I live. But this is a lifestyle, this self-management. It's not a one-off. It's something I do every day. I hope in the future I have to devote less time to it, but in the last 2 years have been challenging because I've also been trying to taper off the fentanyl during that time. And that's been extremely challenging with some lack of support, including at one point a reinstatement to a dose that was quite high. But I'm doing really well now and I hope to continue that. And I'm really passionate to tell my story to other people to show that this is possible and that by reconceptualizing your pain, your understanding of pain, it can really, really change your life. Thank you.
Wonderful, Niki. What an excellent talk. Really fascinating, really inspirational. I'm going to ask you one quick question, if that's okay. Obviously, you talked about finding pain science and finding Lorimer's talks on YouTube as a useful catalyst to help you sort of turn things around. Do you think if you found these things earlier in your journey, they might have been more useful at that earlier stage or not?
I'd like to say yes, but how do you know? I think if I'd had that information in that 2005 pain management course, it would have made a lot more sense to me. I really struggled with the pain gate theory because what's the use of a pain gate in my spine when the pain's in my face? It just made no sense to me. So I'd like to think that, yes, it would have made a massive difference to me then, but you can't say for sure. And later I was so incurious. I'd been told by so many people that this was it, you know, there was no hope, that I stopped looking. So, you know, having this kind of science in the public domain, much more front facing, I think is absolutely awesome. Really important.
Brilliant. Niki, thank you so much. Once again, an excellent and inspirational talk.